If you've looked in the mirror recently and thought, my smile's just not the same, well, you're not imagining it, because here's the truth. Just like your skin ages, so does your teeth. And actually, dullness, yellowing, stains, chips are all parts of the natural aging process. Now, before you reach for that whitening toothpaste or a TikTok hack, let me explain the science behind why your teeth lose their glow and what you can do about it safely and effectively. So, here's what's happening to your teeth as you age. The outermost layer of the teeth is called the enamel, and this is actually the hardest substance in the world. It's harder than bone, but as you age because of abrasion and because of toothbrushing, that outer layer starts to thin out and wear down because of brushing and so on. Now, underneath the enamel, you have a layer called dentin, and this dentin is naturally yellowish in color. As the enamel thins, the dentin starts to show through. Now, add that to years of stain buildup because of coffee, tea, red wine, curry, and even berries, well, you've got a cocktail of discoloration. And it's not just color. As you age, the teeth can start to move. We call it mesial drift when the teeth start to come together. You can get microchips, or they look a little bit uneven. They might even have little vertical fractures. And all of this can make your smile lose its luster and look a little bit dull, tired, and basically aged. And let's be real, aged teeth make you look older than you might want to be. So what can you do? Let's talk teeth whitening. Now, in the UK, there are very strict legislations in order to keep you safe. The maximum legal limit of hydrogen peroxide, the whitening agent, in whitening products sold by your dentist is either 6% hydrogen peroxide or 16% carbamide peroxide, which is a slower release version. Great for if you have sensitivity. The thing that you need to bear in mind is this strength can only be prescribed by a dentist, because this strength needs proper supervision to ensure it's safe for your enamel and for your gums, that it's not actually going to cause you any harm. Now, here's the reality of what a peroxide does. A peroxide penetrates into the tooth structure to break up deeper stains. It oxidizes those stains. By contrast, most of the over-the-counter products that you might find online or in stores are limited to 0.1% hydrogen peroxide, which is essentially not very effective. It's barely enough to freshen your breath, let alone whiten your teeth. So if you've been using strips, paste, or gels and you're not seeing results, then it's not you, it is the product. So let's talk about whitening toothpaste and what this actually does to your teeth, because I get asked this all the time, and I've walked through Boots and I'm actually always tempted to pick one up, even though I know better. So does whitening toothpaste actually work? And in short, the answer is not really, and here's why. Most whitening toothpaste don't actually contain hydrogen peroxide or carbamide peroxide. Instead, they rely on abrasion and abrasive ingredients like silica, calcium carbonate, aluminium oxide, and sometimes baking soda. So what these are doing is they're actually physically scrubbing away surface stains, like maybe plaque and pigment from food and drink. But the problem is, they're only working on very superficial surface level extrinsic stains. And over time, if you're using these abrasives, what will happen is you will wear down the enamel of your teeth. And that's going to make matters worse, because once that enamel thins, unlike bone, it doesn't come back. If you chip a tooth, you've chipped a tooth and you can't grow it back. If you break a bone, you can actually grow it back. So you got to be really careful with your teeth and brush the ones you want to keep, and also make sure that you're using the right ingredients to keep them healthy and sparkly. Now, some whitening toothpaste have blue pigments in them. If you're adding a blue pigment to the tooth, what happens is it creates an illusion of whiteness by creating a slight optical brightening. But it's not actually whitening. So you might feel good for the next hour. By the end of the day, they look yellow again. So here's what truly works. Professional dentist-prescribed whitening trays that are custom-made to fit your teeth. Why custom-made? Well, that means that they actually fit around your tooth shape, and the hydrogen peroxide or carbamide peroxide is sitting really snug to the tooth and doing the work that it needs to do. You need to wear these trays for either an hour or two during the day, which many patients like because they don't like to wear trays at night that can be disrupting to their sleep, or if you don't like to wear them during the day, you can have an overnight one, which is gentler, the 16% carbamide peroxide. And this gently but surely starts to brighten your teeth by lifting the surface level stains. The most important thing to get good results is to use it consistently every night or every day over the course of 14 days, because the effects are cumulative. And once you open up those pores in the teeth, the whitening is able to get in deeper and pull out all the deeper stains or oxidize those stains. And during those 14 days, it's important that you avoid coffee, that you avoid really stained curries, because actually that can make matters worse. So if you do need to have a caffeinated drink, drink it through a straw, which you can see me doing here on my video during my whitening days. Another thing that works is in-clinic whitening, which is usually carried out in the dental chair using a protective barrier to protect your gums. And then the products that are applied to the teeth are usually quite strong, even up to 24% hydrogen peroxide. And although this is something that we used to routinely offer to patients in the United Kingdom, it has now been made illegal to use that level of hydrogen peroxide or that strength. And that's because it was causing severe sensitivity to patients' headaches, migraines, and some of that bleach was entering into cavities and causing problems. So before you have any teeth whitening, you must have a checkup, have your x-rays, and check that you don't have any cavities. Otherwise, bleach can go inside them and cause sensitivity, irritation, and even cause problems in your nerves. If you're outside of the UK, either in the Middle East or in America, you may still be able to get 24% hydrogen peroxide. So check what's legal in your country. Now, these can make significant change in one session, and they're often followed by at-home top-ups because that consistency is important for 2 weeks to get the best results. Now, the thing to bear in mind with the in-clinic treatment is that you will get a degree of sensitivity. So it's not for everyone. But if you've forgotten to whiten your teeth and you're about to get married and you want a smile to match your white wedding dress, then that might be the right option for you. Now, one of the hacks that I've seen go viral on TikTok is a purple mousse that you can apply on your teeth. And actually, I was horrified to find that my husband brought this to our home. It's total nonsense. It doesn't work. It is just an illusion that brightens your teeth for maybe 30 to 60 minutes, but you're not going to get any whitening to your teeth. So I would say that's a hack you want to miss. So I hope this has helped. If your smile has lost its sparkle, know this is one of the things that does happen with aging. Just like our skin ages and our body ages, so does our teeth. So it's important that you look after your teeth, especially if you are conscious of wearing the best smile that you can. Try and avoid having too much coffee. Do know that there are options to remove surface stains, which might be something like a tooth clean, a professional scale and polish, something called airflow, which uses a powder to get rid of superficial stains. Or if you have deeper stains, then my advice is get professional, legal, safe, and effective in-clinic professional teeth whitening. And lastly, make sure you skip the gimmicks, skip the abrasive toothpaste, and protect your enamel. Your smile is worth it. And unfortunately, once you've worn away that enamel, you can't get it back, and that puts you in the realm of having to have more invasive treatments to get back the smile you want. I'm Dr. Yusra Al-Mukhtar. Thank you for watching. If you have any questions about teeth whitening, drop them in the comments below. Don't forget to subscribe and like. And if you have anyone that this will help, make sure you share it, and I'll see you in the next video.